I've been doing a bit of research. Listen to this.
More than a year may increase the risk of specific side effects, such as bone fractures, gastrointestinal infections, and vitamin B12 deficiency. Some signs of vitamin B12 deficiency include extreme fatigue, a sore and red tongue, mouth ulcers, and pins and needles sensation. If you've been taking omeprazole for longer than a year, your doctor should regularly assess your health to determine whether you should continue using it. Did you know about the long-term side effects of omeprazole? Using omeprazole for over 3 months can lead to reduced magnesium levels in your blood. This may cause tiredness, confusion, dizziness, muscle twitches, shakiness, and an irregular heartbeat. If you experience any of these symptoms, make sure to inform your doctor. Continuing
Irregular heartbeat. I've been getting pins and needles over the last year or so, like in my feet and hands, and I just thought, is it too much alcohol? Pins and needles in my hands and legs.
omeprazole usage for...
If you take omeprazole every single day, beware, there are some side effects. I'm going to walk you through them. Hi, my name's Reese. I'm a nutritionist. I work specifically with people who have reflux and they have bloating. Now, if you're taking omeprazole, don't immediately stop based on what I tell you in this video. This is mainly for people who are under long-term use of omeprazole. Now, the first one is it depletes is iron. Iron is essential for you to make energy. It's essential for your thyroid function. So if you're getting really slow weight loss and you've got very low energy, or you're someone who needs regular iron infusions, this might be why. The second thing it depletes is B vitamins. Now, not just B12, although that is one that it definitely does deplete. Things like folate as well, all the other B vitamins, riboflavin, thiamine, etc. But most of the ones that people get tested for are folate and B12. So if you're low in those, you're probably low in the other ones too. And one of the final ones is magnesium. Magnesium is an essential mineral to keep your stress levels low, to have your body wind down. If you're low in it, you get things like muscle cramps, muscle aches, racing heart, tightness in the chest. Those are very common signs of magnesium deficiency. And there may be other minerals too. Now, I'm not saying you need to stop taking your omeprazole, okay? I'm not giving you medical advice about your drugs, but what I am saying is you may want to add some of those minerals in, or you may want to get tested for those minerals on a regular basis to make sure that you're not low while you try to figure out the root cause of what's causing your reflux so you can fix it and not have to take omeprazole ever again. Hopefully you like these tips. If you do, please follow on. If you take omeprazole every single day, beware, there are some side effects. I'm going to walk.
There's many side effects and shouldn't be taken long term. This medication is omeprazole or lamb.
I was on omeprazole for over a year, and I don't even have acid reflux. I have motility issues with my esophagus, specifically the upper part. The main muscle in the upper sphincter does not work properly for me, which causes a lot of esophageal tightness up there, as well as sometimes an inability to swallow. My GI doctor suggested that I get on omeprazole because sometimes omeprazole can help treat motility issues. They never told me about the side effects. They prescribed it to me long term. So several months into taking omeprazole, I started noticing that I was developing issues with the lower part of my esophagus, as well as extreme weakness in my joints, specifically my knees, my wrists, and my neck. I constantly felt like my neck was popping out of place, and I always felt like my knees were going to give out underneath me. Not good. I saw a lot of things about the side effects of omeprazole, and that weakness in your joints and your bones being more susceptible to breaking was a side effect if you were on it for long-term use. So I decided I'm just going to quit cold turkey and see if my symptoms get better. And they did. It's been a few months since I've been off of it. My joint weakness is a lot better. My lower esophageal issues are pretty much non-existent. And a lot of the throat tightness that I was dealing with on a daily basis. Here are 3 things I wish I knew.
See, everyone has different side effects. Affects people in different ways. I mean, I might get different side effects to you. You might get different side effects to me. But I've been on it for 20 odd fucking years. I'm probably too far gone. That's why probably I can't fucking lose weight. Oh, well, it's a crap I eat anyway. I eat a load of crap. But I've always got low energy.
Before I started taking omeprazole for my acid reflux. If you're new here, my name is Molly. I'm now a gut health registered dietitian that specializes in acid reflux and IBS. But years ago, I struggled with severe GERD and acid reflux IBS. So I wish that I knew that PPIs reduce stomach acid and that the root cause of so many people's acid reflux, including my own, was low stomach acid. So it was actually not addressing my root cause. Number two, PPIs are not designed to be on long term. And some doctors will tell you this, some doctors won't, but they're not really designed for long-term use. Number three is that they can decrease nutrients like B12 and vitamin D, and we want to make sure that we're getting food sources of those vitamins or supplementing. If you're looking to heal acid reflux, definitely hit the bless button and join this community. Here are 3 things I wish I knew before I started taking omeprazole for my acid reflux. If you're new here, my name is Molly. I'm now a gut health registered dietitian.
So apparently people are unaware that there are dangerous side effects from taking omeprazole for a long period of time. So I'm going to enlighten you guys. First, let's understand how this drug works. What it does is it poisons the acid-secreting cells inside your stomach, which reduces your acid. Therefore, when you eat food, you can't digest it properly, you can't break it down properly, and more importantly, you can't cleave the minerals from your food. Why is this important? Well, this is what leads to a lot of the side effects of omeprazole. And no, I'm not talking about short-term use. Yes, I'm talking about more long-term use. And that's when you really start to run into problems of extreme tiredness. Because guess what? You need those minerals to make energy. Iron deficiency, magnesium deficiency, calcium deficiency, deficiency of B vitamins, deficiency of zinc, which you need for stomach acid, by the way, which is going to exacerbate all of your problems. So yes, all drugs have side effects, but especially because they deplete minerals. It doesn't matter which drug you're talking about, but specifically omeprazole is going to deplete the B vitamins I spoke about, magnesium, iron, and it's going to make you extremely tired. So if you take omeprazole on a daily basis, you need to understand this, you need to check for those minerals, and I like to get my clients fixed up so they can get off those drugs and live a good, healthy life. If you like these tips, please follow along for more. So apparently people are unaware that there are dangerous side effects from If you want some herbal alternatives to actually fix your reflux, this video is for you. Now, if you've ever watched any of my videos before, you know that I think that there are 4 main causes of acid reflux. H. pylori, yeast overgrowth, bile inside the stomach because your gallbladder, and the final one is nutritional deficiencies. Now, I'm going to give you something for each one of those things. I'm going to start with the thing that's probably causing your issues, which is H. pylori. Now, H. pylori is a bacteria that sits inside the walls of the stomach, secretes an enzyme called urease, which decreases your acid production. Then you don't have enough acid to digest your food, and you end up getting reflux. Now, most people will run straight to the antibiotics, but I don't like using antibiotics. You can create more damage, and that will stop you fixing the problem, even if you don't have the H. pylori. So what I like is Pylopurge. That contains nutmeg, 2 types of curcumin, mastic gum, and broccoli sprout extract. Now, you can buy them all separately, or you can just grab Pylopurge. The link's in my bio. The second most common cause of acid reflux is yeast overgrowth. Yeast is very tricky because normally what you have to do is you have to pair the right yeast with the right antifungal. But generally, when I work with someone, if I'm not sure, my go-to herb is garlic. The third major cause of acid reflux is not having a gallbladder or having problems with your gallbladder so that you end up with bile inside your stomach. That causes reflux, irritation, gastritis. The first thing on my list when I have somebody who has gallbladder reflux or bile acid reflux is vitamin C, because that will thin the bile and sometimes that helps. I also made a course underneath the link in my bio called Series, which is called Bile Acid Reflux. It goes for a couple of other things that may be able to help you. And the final one is not having enough minerals. I normally see this in people is you end up with low minerals and then you can't make stomach acid. Some of the most important minerals to make stomach acid would be all of your B vitamins, magnesium, and zinc. Hopefully that helps. If you please follow on for more. If you want some herbal alternatives to actually fix, if you have burning acid reflux every single day and you have no idea what the root cause is, this video is for you. Hi, my name's Reese. I'm a nutritionist. I work specifically with people who have reflux and they bloat and get to the root cause of their problem. And luckily, there are only 4 main causes of acid reflux. The first one is an H. pylori bacterial infection. Now, H. pylori is a particularly nasty bacteria that sits inside the walls of...
What's a soulmate?
Does a hiatus hernia...
If you see me happy,
3, 2, 1. Back.
And we're down. Oh, 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 oh. And we're down.
sad truth about why people never fix their acid reflux and bloating is because they're held back by their own limiting beliefs. They've been sold by someone else. Let me give you an example. You have acid reflux, you go to the doctor, he says, take this omeprazole for 2 weeks. You take it for 2 weeks, you come back, it didn't do much, slightly better, but it didn't really fix the problem. Then they send you for an endoscopy. You wait 6 months, they stick a camera down your throat and they say, we can't see anything wrong, carry on taking the omeprazole. Now, this is where the decision is made. Right? You can just say, okay, no problem, you take your omeprazole, and 40 years later, you end up with various different problems because you suppressed your acid production, which you need to break off minerals from your food, and now you've got bigger problems. Or you say, hold on a minute there, if I've got burning acid inside my throat and you look inside and you can't see anything, does that not mean the test that you're using is shit and might need some upgrades or some changes? Or maybe what the problem I have is not detectable with the test, or it's not looking for the problem that I have. But if you just accept that you're and there's nothing you can do about it, then you end up going down that route. Whereas if you ask the right questions and you're curious, that, my friends, is how you fix your problem. One of the sad truth about why people never fix their acid reflux and bloating is because they're held back by their own limiting beliefs. If you take PPI medication like omeprazole, lansoprazole, pantoprazole, and you're extremely tired, this might be why. Hi, my name's Reese. I'm a nutritionist. I work specifically with people to get to the root cause of their reflux and their bloating. Now, a lot of people I'm working with are either currently taking PPIs or they took PPIs for a really long time. A little brief explanation, and no, I'm not a doctor, but what they do is that they block or poison your body's acid-secreting cells from producing stomach acid, which temporarily buys you relief from the reflux, but long term it stops your body breaking minerals away from your food, and so therefore you use up the minerals that your body stored and you end up deficient in those minerals over time. Some of those ones that are really, really common when you take omeprazole are iron, magnesium, and B vitamins. Now they are all used for energy, so the longer you take those, and when you don't have them in as supplementation, you're going to get low eventually, not right now, not immediately, and definitely not short term, but over the longer term, and the longer you take it, you can start getting deficient in these minerals. And if you do that, you're going to end up tired. What I normally recommend the people I work with do is get mineral testing for magnesium. You need red blood cell testing for iron. You can get that checked by your doctor. Taking omeprazole for a long period of time. So I'm going to enlighten you guys. First, let's understand how
serious side effects of omeprazole. I ask this to my patients every single day. Have you had following 3 serious side effects? Number 3, cutaneous and systemic lupus erythematosus. Wow, that's a tongue twister. This condition involves inflammation in the skin or throughout the body, potentially leading to serious health consequences. 2, Stevens-Johnson syndrome, a severe skin reaction that can cause blistering and shedding of the skin. Seek immediate medical help if you experience this. Let me know in the comments if you want me to explain.
Yeah, I do between me groin. Yeah, I get itchy and fucking that side effect, yeah.
Any of these further, and also share 3 further more serious side effects. And the final one is the most severe, which is severe allergic reaction demanding immediate medical attention. Signs may include difficulty in breathing, swelling, or a severe rash. Patients always ask me this question. Serious side effects of omeprazole. I ask this to my patients every single day. Have you had...
This is a big issue for both patients and doctors, but here's what I recommend you do. I'm Dr. A, GP based in the UK, and this comment is very fair. With increasing workload, less and less GPs per capita, medication reviews are getting delayed. I did a video recently on omeprazole which got significant views and comments, which I have been trying to read and keep up on, and it's quite worrying how many people are asking whether they should or shouldn't be on it based on their situation. The key is every medication you're on, you should know why you're on it, the risk of the medication and the benefits to you. So if you don't know why you're on a long-term medication, you don't know any potential side effects of the medication, and you don't know any benefits to you, then these are points you really need to clarify. Now this brings me back to this comment, how do you get a review done, or any questions you have, and how do you ask your doctor these? Here are some practical steps I think you can do to try and achieve this. Firstly, if you go into the doctor and they recommend some blood tests or starting a new treatment, first, again,
Did you know about the long-term side effects of omeprazole?
Here's what you didn't know about taking omeprazole. Although effective, long-term use can lower magnesium and B12 levels and can increase the risk of osteoporosis. Omeprazole and lansoprazole are 2 Do you take omeprazole daily? In the UK, there's more than 1.5 million prescriptions for omeprazole or PPI, which is an acid suppressant in the UK, which people will be taking for heartburn or to protect their stomachs from certain medications. And this is an important drug and it has very, very many important uses. So don't just stop taking it now. But what people don't realise is that omeprazole and other drugs like it can cause a reduction in important nutrients and vitamins in your body, which can then lead to you feeling like crap. Long-term use of omeprazole can lower levels of magnesium in your...
Omeprazole, yes or no? Everybody, I'm Dr. Michael Johnson. I've been in private practice in Appleton, Wisconsin since 1983, over 40 years in functional medicine. Another question I get a lot is about omeprazole. And it's a big no. You don't need it. You don't need it for heartburn or GERD or whatever else they're giving it for you. It's a drug. It's a hepatotoxin. Hepatotoxins are toxic to your liver. If you want to get rid of heartburn or GERD or acid reflux or whatever they want to call it, start taking digestive enzymes. I have a specific digestive enzyme that I use. I can email you a link to it if you're interested. I don't care where you get it from. Just start taking it. Everybody over the age of 25 should start taking digestive enzymes because here's what's happening. This is why you need omeprazole. Well, when you're eating the food, you don't have enough HCl. And think of HCl, hydrochloric acid. That's your stomach acid. Think of a dog. A dog eats another dog's defecation. It doesn't get sick. Why? Because it has so much HCl in its gut. Well, as you age, your HCl, your stomach acid, decreases. So you're not absorbing your fats, carbohydrates, proteins. So you're eating food, it's not being properly digested, and that is turning into lactic acid, and it's lactic acid that refluxes. You don't need a drug. You just need to take, you need digestive enzymes. You know, it just hit me. Before it was the purple pill, remember? Prilosec, then they switched it around a little bit, and it's Nexium, and now it's omeprazole, and
Hi everyone, it's Dr. Dave Morris of Magnolia Medical Center here in Murfreesboro, Tennessee.
Scary drug facts. A nice followers asked me to cover a medication that I was personally taking for acid reflux. It's called omeprazole. I have already done this video previously, but let's get into the long-term use side effects. There are 6 main ones. The 6th one I experienced personally. In fact, the first one I experienced personally as well. Here we go. Number 1, bone fractures. Yes, I had complete reconstructive surgery on my left ankle. Plates, screws, washer to put the malleolus back in place, the works. Vitamin B12 deficiency. You get a lot of energy from vitamin B. This medication is sucking now. Kidney damage, increased risk of infection, interference with other medications, and number 6, rebound acid reflux. Once you go off the medication, it hits you like a steamroller. Scary drug facts. A nice followers asked me to cover a medication that I was personally taking for acid reflux. It's called omeprazole. I have already done this video previously, but let's get into the long-term use side effects. I think it's...
Do you take omeprazole?
So omeprazole is also known as...
This is one of the most commonly used drugs in the world. This is...
Here are 3 things I wish I knew before I started taking omeprazole.
When you are taking drugs like omeprazole, you have to be mindful of the fact that they have a high stroke risk, but also understanding that they rob your body from the potentiality of digesting proteins effectively and absorbing minerals. Omeprazole is going to do 0 to restore the mucosal lining to the stomach and esophagus because it's a prescription drug. It is not a food.
Yeah.
In this video, I'm going to detail exactly how I cured my acid reflux. Hi, my name's Reese. I'm a nutritionist. I work specifically to help people fix their reflux and their bloating. And I had acid reflux. It was awful, and I couldn't get to the bottom of it. I've taken omeprazole, I was taking over-the-counter Zantac, which has now been removed because of cancer scares. I went to my doctor, they couldn't tell what was wrong with me. I went for an endoscopy, they told me, Mr. Manda, you're fine, we can't see anything wrong with you, take omeprazole for the rest of your life. And so I was a little stumped. I didn't want to take drugs. I was a young man in my early 20s. I didn't want to take drugs for the rest of my life, but I didn't have much of an alternative back then. I had the stool test done and found out there was yeast in there. And lo and behold, once I killed that yeast, my reflux disappeared. Now, since then, I've had reflux maybe a couple of times over the last few years, and it's always been yeast. So I know for me that yeast is more than likely my issue. I've also had H. pylori, which caused a bit of reflux, and killing that got rid of the reflux too. So I'm here to tell you that there is a reason you have reflux. It might be H. pylori, it might be a yeast overgrowth, it might be a nutritional deficiency, it could be low stomach acid due to stress, or it could be a combination of one or more of those issues. But you definitely have a root cause, and if you don't want to take omeprazole for the rest of your life or suffer from burning acid reflux every single day, you are going to have to get to the root cause of your problem. I make videos every single day here on this platform, so please follow along to make sure you don't miss out.
No, because Alexa.
Do you suffer from gastritis?
So yes, long-term omeprazole is bad. Sometimes omeprazole is needed in the short term to allow the ulcers to heal while you're...
Step one, you're going to want to make a cold infusion of marshmallow root. Marshmallow root is really high in mucilage, which can be very effective at...
If you take omeprazole every day for acid...
You had a hiatus hernia. You had a hiatus hernia. Here's your prescription for omeprazole for life. I'm Dr. Ray, a GP based in the UK, and in this video I'll discuss one of the most popular questions that's been asked is, what do you do if you have a hiatus hernia? Do you put up with omeprazole for life and risk the potential side effects? Now firstly, a lot of people actually have a hiatus hernia without any symptoms. In normal anatomy, what happens is that the stomach sits below the diaphragm, and there's a small hole for the esophagus to pass through. But in a hiatus hernia, for some reason, the stomach pushes up through the diaphragm. Now this is generally diagnosed with endoscopy.
I need to do some more research. I need to do some more research on that. Fucking, I've been on it for 20 odd years. Fucking hell. I'm always bloated, full of gas. It's no good, man. Too much yeast in my body. Is it because I'm eating too much bread? I don't know. Yeah.